Hello, this is Dr. Gay from First Look MRI, and this is a 51-year-old male with complaints of radial-sided wrist pain and swelling for about 6 months. They saw a hand surgeon and they thought clinically they had Quervain's Tenosynovitis, and so we look over here on the radial side of the wrist for findings. Now, Quervain's is usually seen in people who are between 30 and 50 years old, more common in female, so this is a little bit of an outlier. This guy's 51, he's more than 50. He's a male, not a female. It can be seen in people who have rheumatoid arthritis, or mothers who are lifting babies, or people who have hobbies where they do something unusual that put stress on these tendons over here along the radial aspect. And this gentleman doesn't have a history of any of those. So again, he's a little bit of an outlier with his age, and he just doesn't quite fit the profile. But as we'll see here, he does have abnormal signal in one of these two tendons along the radial wrist. So I guess this still would fall into the category of Quervain's. And so here we go. There are two tendons along the radial aspect of the wrist we're going to look at here. This is the radius, this is the radial margin here, and we see two tendons in the first compartment here. One of them is the abductor pollicis longus. APL looks nice and dark and uniform, looks just about right here. But right next to it, this guy does not look quite right. This is the extensor pollicis brevis. You can see that it looks kind of flat. You see a longitudinal band of signal right within it there. It looks like a longitudinal tear between or fluid between the longitudinal fibers. We also see that it looks like there's fluid in the tendon sheath. As we go out here distally, this is going to go into the thumb. As we get into the thumb, here we have the first metacarpal. You see it split into two components there. So this is a tendinopathy with a partial thickness longitudinal tear. More proximally, it looks like it's a full thickness longitudinal tear here within the thumb, and fluid in the tendon sheath compatible with tenosynovitis. And we'll look on the PD fat set sequence here. So on this PD fat set sequence, this is the radius, more towards the metaphysis here, and we can see the muscle ending. There's a tendon. We see fluid in the tendon sheath. We see this partial thickness longitudinal tearing here more proximally. And as we go more distal, we see this complex fluid distending the tendon sheath, and then really a longitudinal split that looks like it may be full thickness right here. So again, Quervain's tenosynovitis with underlying tendon abnormalities, as we can see here, and its a friend here next door, the abductor pollicis longus, looks intact. Again, a lot of times both of these will be inflamed or thickened or irregular. Here it looks like it's more localized just to this extensor pollicis brevis. And that's it. Thank you very much.